Most people think if their kidneys were failing, they would feel pain. They assume they would feel an ache in their lower back or that it would be obvious. But here is the scary medical truth. Your kidneys are masters of disguise. They can lose up to 90% of their function before you feel any specific pain. In medicine, we call chronic kidney disease or CKD a silent killer, and that's because the early signs aren't pain. They are subtle changes in your daily life that 9 out of 10 people ignore until it is too late. I'm Dr. Ngundi, and in this video, I'm going to walk you through the 3 specific signs that your kidneys are struggling to filter toxin. These aren't vague symptoms, these are physiological red flags. If you notice 2 specifically, you have to see your doctor immediately. And let's get into it. The first sign is something you might see every morning but flush it away without thinking. It is persistent foamy urine. Now, be careful here. I'm not talking about bubble caused by the speed of the stream hitting the water. Those bubbles pop and disappear quickly. I'm talking about foam that looks like beer foam or beaten egg whites, and it stays there. You might even have to flush twice to get rid of it. And why does this happen? And to understand this, you need to understand how your kidney works. Inside your kidneys, you have millions of tiny filters called glomeruli. Think of them like a coffee filter. A coffee filter keeps the ground, which is here the good stuff, inside and lets the liquid, which would be the waste, pass through. Your kidneys do the same job in your body. They are supposed to keep albumin, which is a vital protein, in your blood. And albumin is crucial because it acts like a sponge to keep fluid in your blood vessels. When your kidneys are damaged, often from high blood sugar or high blood pressure, those filters develop holes in them. They become leaky. Protein then slips through the holes and ends up in your urine. Because protein changes the surface tension of urine, it creates foam. In medicine, we call this proteinuria or albuminuria. If you see this consistently, it is a massive red flag that the physical structure of your kidney is compromised. It's one of the early signs appearing long before your blood test might show failure. The second sign is the most dangerous because it creates a vicious cycle. It is high blood pressure that is difficult to control. Now, most people think, well, I have high blood pressure and that might hurt my kidneys eventually. Well, that's true. But did you know it works the other way around? Damaged kidneys actually cause high blood pressure. And here is the physiology. Your kidneys are not just filters, they are also your body's pressure regulators. They produce a hormone called renin. When your kidneys sense they aren't getting enough blood flow, or if they are scared and damaged, they panic. They think your body is dehydrating, and so they release huge amount of renin. This triggers a chain reaction that constricts your blood vessels and forces your body to hold onto salt and water to raise your pressure. If you are someone who has always had a normal blood pressure, let's say 120/80, and suddenly it spikes to 140/90 and stays there, or if your blood pressure medication suddenly stop working, do not just blame stress. And that is often a scream for help from your kidneys. They are losing the ability to regulate fluid balance. The trapped sodium and water increase your blood pressure, pushing your pressure up, which damages the kidneys further. It is a loop you must break. Sign number 3 is tricky because we blame it on everything else. Aging, lack of sleep, or stress. I'm talking about unexplained fatigue, weakness, or getting cold easily. But I'm not talking about just being tired. I'm talking about a specific medical condition called anemia of chronic kidney disease. Most patients are shocked when doctors tell them this. Your kidneys are responsible for your blood count. Your kidneys produce a hormone called EPO or erythropoietin. And this hormone travels through your bone marrow and gives the order, make more red blood cells. Red blood cells carry oxygen to your brain and muscles. When kidney function drops, EPO production drops. You literally stop making enough red blood cells. So, even if your heart and lungs are perfect, your body is suffocating on the cellular level because you don't have the red blood cells to deliver the oxygen. You might feel dizzy, have trouble concentrating, feel unusually cold when others are warm, or get short of breath working upstairs you used to climb easily. If you have this fatigue plus the foamy urine, you need lab drawn immediately. So, if you notice these signs, what do? Don't just go to your doctor and say, check my kidneys. You need to be specific to catch this early. Standard blood test, which is mainly creatinine, can sometimes be normal if you have early damage. You need to ask for three things. And the first one is EGFR, which is estimated glomerular filtration rate. This tells you the percentage of function your kidneys have left. Two, that is albumin to creatinine ratio or UACR. This is a sensitive test for the leaky filter. And the three, blood pressure check, obviously. And to round this up, let's say your kidneys are resilient. If you catch these signs early, in stage 1, 2, or even 3, you can often slow or stop the progression through diet and lifestyle, which is exactly what I teach on this channel. And if you want to know which foods are actually helping you protect your kidneys and which ones are destroying them, you need to watch this video right here where I talked about salt. Don't ignore your body's whispers before they become screams. I'm Dr. Ngundi. Stay fit, stay healthy, and I'll see you in the next video.